So guys, basically the future of ethics, or the main feature or the main topic that we're studying in ethics is what is good. Okay? Our goal is to answer what is really good. Because if you're dealing with lives, not everything class will be obviously good. Not everything will be easily visibly good. Okay? Hindi siya balakuan nga sa isa mo lang katulok mambal mo ay good, ay bad siya. Okay? It needs analysis for us to confirm whether something is good or bad. Okay, so one of the questions that arise in ethics is that what is good? And when we talk about good, there have been several definitions of good. So Plato, for example, would say that there is only a single form of good and virtue. Whereas for Aristotle, there are multiple virtues of varying degrees, and that virtues can be acquired through the practice of habit. So if you would look at this definition from these two philosophers, Plato and Aristotle, you would come to understand that even philosophers do not have a definition of good, okay, or do not have a concrete definition of good. The definition of good will vary from one philosopher to another. Okay, that's the main message of this slide that we need to understand. But in terms of ethics, what do we really mean when we say what is good? So there are different types of good. You have what you refer to as honorable good. You have what you refer to as pleasurable good, and you also have what you refer to as your useful good. So when I say honorable good is considered to be desired in itself because of its intrinsic goodness. Okay? In other words, class, for example, health. When I say that you need to be healthy, it's good. And that type of good is what we refer to as honorable good. Okay? Or let's say, for example, I will say, class, you need to be honest. Honesty is honorable goodness by itself because it's intrinsically good. Okay? And man would naturally tend towards this good. So for example, virtue, health, science, and wellness. Okay, you need to look into this good. Okay, so those are the types of honorable good. But on the other hand, when I say pleasurable good, this would mean silences desire that produces joy. Okay? To understand that one, an example is these are sense perceptible good produces pleasure or delight and satisfaction, which is produced by scientific knowledge. So for example, if you're taking food, we know that food in itself is needed by our body. But if we are seeking nice tasting food, if we are seeking people who can cook well for our food, these are all referred to as pleasurable good. Okay? Kasi kumbaga, you're seeking pleasure, you're seeking desire, you're seeking joy towards it. That's why it's referred to as pleasurable good. On the other hand, another is useful good. Look at the term, useful good. The good is not desired for its own goodness. Okay? Kumbaga, the substance itself may not be good, but for the sake of attaining some good. Ito kasabad, intindihan, no? Look at the definition. The good is not desired daw for its own goodness, but for the sake of obtaining some other good. Look at the example. Okay? Here, I'll have an example for that. Example, bitter medicine to obtain health or painful surgery to help a person recover from a diseased organ or be healthy. Okay? If you can recall, diba, when you were young, especially when you were younger, you would take medicines that are not very palatable. Okay? You would take medicines that would not taste good. But still, you don't have a choice, but you need to take it because it is that medicine that will be able to help heal your condition. Okay? So if you will tell a child that this is what you need, okay, even despite the bitter taste of the medicine, that is useful good. Okay? Or another example given here. For example, if a patient needs to undergo painful surgery just to recover from a diseased organ or just to be healthy, that is also considered to be useful good. One very good example of that is what you refer to as your amputation. Anybody who is familiar of amputation? Anybody familiar of amputation? None? Okay, I'm searching on my screen. As you can see, class, this is an image of amputation. So when I say class amputation, close. Okay, so dear students, when you say amputation pertains to the cutting of the organ or cutting of the limb. No? Okay, in example, if you have noticed in that picture that I have shown you on screen, okay, that would mean that gincut ang isa ka part sang lawas. Example, the legs. Okay, let me see. Okay, that's an example of a picture of amputation. Okay, so you can see here that a part of the body, okay, a part of the body have been removed. Okay, kung makita nyo yung example, can you see that example on the right side of the screen? That's an example of amputation. Okay, but allow me to show this one. This one is an example of traumatic amputation. Okay, this one naman is an example of traumatic amputation. When I say traumatic amputation, it was not done surgically. Probably the patient had an accident that led to traumatic amputation. Okay, allow me to search the term traumatic amputation so that you will understand. Okay, I'm so sorry, some of the images seem to be censored, but let's see it. Just an example of a traumatic amputation. Okay, but that is not the useful good that we are talking about. What we are talking about is your surgical amputation. When I say class surgical amputation, like this one, okay, let me see if it's a legit example of surgical amputation. No, that's not it. Okay, this is an example class of your amputation. This one, the first example that we had, that is an example of surgical amputation. So kung tulukon nyo, no, come to think of it, will it be good? Kaya ginutod mo ganing isa ka parts ang lawas niya. Okay, sometimes patients would say nga, I don't want a part of my body to be cut. I don't want that the part of me would be missing. But in that case, class, it was needed. Okay, among the common conditions that lead to this is your diabetic foot. Okay, so nga asar nga kilanlan utdon because of what you refer to as your diabetic foot. Ano class ang ibig sabihin or what do you mean by diabetic foot? Your diabetic foot would usually start like this one. Okay, the one on the picture here. Kita nyo class ko diin gahulag ang mouse ko. Can you see that? Okay? So class, amo na usually pag umpisa sang diabetic foot. However, class, when your diabetic foot would become more severe, nga nagasaka siya class, there's already presence of necrosis. Okay? As you can see in this picture, kita nyo ng itom, di ba, you are taught in health assessment that whenever there's darkening, okay, or whenever there's black tissues, it would already signify necrosis. Okay? Or if you would look at this diagram, this would show to you the progression from your grade 0 to grade 5 diabetic foot. Okay? So anong obrahon? Class, usually there will be amputation. Okay? One type of amputation is your BKA. It's referred to as BKA because it's below the knee amputation. So if you would look at it, it's as if that you will say to yourself that, syempre, you don't want the patient na mabuhinan iya TL. However, if hindi mo pag-ikat ang TL sang patient, if the doctor will not be doing it, what would happen is that the necrosis would go up the body until your patient will die of sepsis. When I say sepsis, what is sepsis, dear students? When I say sepsis, what do I mean by sepsis? Anybody?
Extreme response to an infection, sir.
Okay, sige. What else? Thank you for that, Nia. Yes, it's an extreme type of infection. So plus when I say sepsis, oftentimes you need to note that sepsis is bacterial infection already. Okay, it's a bacterial infection, meaning plus the presence of infection is already in the blood. So that's why we need to cut that part of the body, or else plus your patient would have septicemia, okay, or sepsis, and don't want that to happen. Okay, that's what you can see on your screen right now is the usual presentation that I saw in the emergency room. So do amo na itsura ya, tapos until nga mag-amat-amat siya ito. Tapos kis a class, other patients would say nga ti sir kuku kumalang nagaitom nga aot dun gintanan. Okay? Class, the outward appearance is not actually the determinant until where the amputation will be done. Although class, the gangrene or the necrotic part is only on the toes, it might be that the blood vessels inside below the knee are already affected. So that's why the amputation would usually be up to below the knee. Okay? So that is an example of your useful good. Another thing plus that we need to remember in ethics is your laws, norms, and codes as reference point for human act. Okay? So if you would look at laws, the laws would tell us what is legally good and what is legally bad. Okay? You have your laws. So what's the highest law of the land, gani? What's the highest law of our land? Anybody? what's considered to be the highest law of the land. Let's say, for example, in the Philippine setting, anong kinakonsider natin nga highest law in the Philippines? What do you call that document made in 1987? Anybody even on chat?
Constitution, sir.
Okay, very good. That would refer already to your constitution. Okay, your 1987 constitution. Kumbaga, 1987 constitution is referred to as the law of laws. Diba? So it's from where all other laws emanate from, or it's from where all other laws are being. Okay? So sir, no connection ng law sa ethics. It is the law that would tell us whether the act is legal or not. Okay? For example, if I will talking about human trafficking, okay, for example, lagadon, tabi kamo tanan, guys, makadto ta sa US, malagaw-lagaw ta. Tapos pag abot dito sa US, gin pamaligya ta kamo or hindi gani gin paobra ko kamo nga domestic helper, okay? I could be held liable for human trafficking. Okay, that's human trafficking. And sadly, that is still occurring until to the present, no? It's still occurring until the present. So we do not tolerate those kind of behavior. Now, what are the different types of law? The natural law is still in picture. When I say natural law, it is the eternal law that refers to the plan of divine wisdom. Okay, that is where the picture of God would come in. That is where the picture of Allah would come in. Okay, with all due respect to the different belief and religions that you all have. Okay? It is in itself eternal law, meaning it is implanted in beings endowed for reason and inclining them towards the right action and end. A very good example of this for Christians is your 10 commandments. Okay, for Catholics especially, you have your 10 commandments. Okay, so di ba if manotice ninyo, the 10 commandments speak of things that we must not supposed to do. Okay, so they're considered to be part of natural law. And it consists of very light reason that enables us to discern good from evil. It is considered to be natural because it consists of the light of reason that each person has by nature. Okay, so that's what you do. So what's the purpose of your natural law? If you would look at natural law, the purpose is to guide also the civil laws. Okay, the purpose of your natural law is to guide your civil laws. Now, when I say civil law, the purpose is to protect the freedom of the people. And freedom comes with responsibility. Inabala nga when we say, in every right, you have a responsibility. Okay, in every right, you have a responsibility. Now, class, when I say right, does everybody deserve rights? Does everybody deserve rights?
Yes.
Yes.
Okay, yes, that's a big yes. Okay, but oftentimes we differentiate the term right to privileges. Okay, we differentiate the term rights versus privileges. When I say class rights, yes, it's for everybody. When I say class privileges, it's for a chosen few. Okay, it's for you only. What is an example of a privilege? The practice of nursing is considered to be a privilege. Okay, the practice of nursing is considered to be a privilege. Bakit siya naging privilege? Kaya ang tupad balay mo, hindi man ay a nurse. Okay? Hindi man talang nga kasakay mo sa jeep, mga nurse. Hindi man talang nga masugata mo, nurse. Hindi man sila tanan, pwede maging nurse. Okay? In other words, it is only a privilege that is given for those who have completed the BSN degree and who have passed the board examinations. That's why it's a privilege. But when I say right, everybody has a right to be born. Everybody has the freedom of speech. Everybody has a right to be protected. Everybody has a right to education. Nurse ka man niya or whatever profession is that, you have the right to education. Okay? One thing that we need to remember is that, again, freedom comes from responsibility, or with freedom, you need to have responsibility. Why do you need to remember this? In the clinical setting, we orient our patients to have their rights. Okay? For example, we orient them that they have the right to choose their medical practitioner, or they have the right to choose their healthcare provider. Okay? Meaning, if the patient would come in the ER, I could not tell the patient, sir, dito ka lang kay doktor porque pa-admit kay balaan mo nami na siya nga doktor. Okay? Or sir, dito ka kay doktor porque pa-admit balaan mo pa maestro na sa namon. You cannot do that because the patient has the right to choose. Okay? So, however, by the time that your patient would choose, for example, Dr. A, your patient chose Dr. A to be the doctor, your patient has a responsibility to settle the bill and to settle the dues with Dr. A. Okay? That's how it works, no? Especially in the private setting. Or for example, since your patient has the right to choose, may right to choose si patient eh. Like for example, ma'am, para si doc nga mapa-CT scan kita. Okay? Kay need sa condition mo, CT scan. So class, when I say CT scan, it's already an advanced imaging study that would entail to look into the organs of the body in a two-dimensional way. So anyway, mambalang patient, ay hindi, kuya, I refuse. Okay? It's the right of the patient to refuse. However, your patient has the responsibility to tell the truth. Okay? Your patient has the responsibility to tell the truth. For example, if the doctor will ask, ano mga maintenance medications mo? And then the patient will say, wala. Ay, hindi siya gusto manugid, for example, sa maintenance niya. If there comes a time nga nagsala ang management sa patient nga na, nagsala ang bulong nga ginhatag sa patient nga na because she withheld information, the doctor is not liable. Okay? Because patients are reminded nga, they have the right to choose, but they have the responsibility to tell the truth. Okay? So that's how we assert in the clinical setting. Because in the clinical setting, class, yes, we are stewards of care. We care for our patients, but it does not mean that we tolerate everything that we will do. Okay? Okay, for example, you are the nurses assigned. Tapos gulpi lang gintandog ka ni patient in your private parts. Will you allow it? Will you allow it? Kung gintandog ka ni patient sa private part? Okay?
No.
Dapat
No,
you should,
sir.
you should give a very big no to that, no? Do not allow it. So what will you do? Tampaon ng pasyente? Hindi man, di ba? Okay, hindi man pwede nga tampaon ng pasyente because that's not how we act as nurses. Okay? But you need to tell the patient, sir, I don't want you doing that. Sir, I notice you touch my butt. Sir, I notice you touch my private part. Hindi ko na gusto maliwan. Okay? So that could happen. Ma'am, sir, especially right now that we acknowledge also the different genders that we have, no? So pwede yang ang touch niya, laki to laki, bayi to bayi. So whatever it is, you do not tolerate it. Even they have the right to care and treatment, they also have the responsibility to comply with that. However naman, sir, paano kung ang pasyente ko mentally impaired? If your patient is mentally impaired, the same approach. You tell him, ma'am, I notice you touch me. I don't allow that. Okay? You need to tell them that. But of course, you need to understand that they did that because of their mental illness or their mental health problem. Okay? Pero hindi nyo gidyapon pag-tolerate or else your patient would keep on doing it. Sir, paano sir kung ginlumbatan ako? Okay? You need to warn the patient. Okay? Kung the next time, if you will not stop, I will call on the security guard. Okay? Pero never ever nga magsinggit sa pasyente, never ever nga sumbagon ang pasyente, never ever nga tampaon ang pasyente, kag never ever nga balusan ang pasyente. Understand the point? Okay? I'm just telling you that that's the reality in practice. There will be times that would happen. Okay? One of my companion, for example, in the hospital, was threatened by the patient. The patient said nga, ay kung hindi mo ko diya pagpagwaon, daw sakiton niya yata, daw amo na ang balian, sakiton ta ka. Okay? So what did we do? Okay? She prompted the security guard, and the next time that she entered the patient's room, the security guard is there waiting outside. And in cases of your aggressive patients, this is taught in your psych nursing, dapat you should be standing near the door. Dapat you should be standing near the door. That's part of your nursing knowledge. When you are dealing with aggressive patient, stand near the door and with the doors open. How with the doors open? Okay? Kay class, if you will punch back, if you will seek revenge to a patient who is mentally incapacitated, it is your license that will be at risk. Okay? So sir, how do we deal with this? You just think, class, that the problem is not the patient, but the disease process of your patient. You are not dealing with the patient itself or the patient himself or herself. But what's actually happening is that there's something going on with the patient. May that be on the patient's mind or the patient's physiology that is affecting this. Okay? In the same way, dear students, kung singgitan ka mo sa pasyente niyo, no? For example, masinggit, mga nurses, mga tanga, mga hinay sa inyo, okay? Things like that. Hindi ka mo magbalos, sir, katanga ang gani sa imo. Okay? Hindi mag-respect mga amo na. Okay? Instead, what you're going to do is that you ask the patient to calm down. Kumo, sir, makalma kita danay. If ang patient aggressive, call the security guard. Okay? If nagkalma siya, class, allow the patient to calm down, allow the patient to talk. In a while, they will realize that what they did was wrong. Okay? Tapos kamo naman, don't take it personally. Okay? Basi bala pag-abot mo sa balay mo, hibi-hibi, ikaw hambal ka pasyente, law-law ko, wala ko pulos ka klase ka nurse. Okay? That might not be true because, again, there's a problem on the inside of your patient and not on you. Okay? Are you getting my point on that, okay? Sige. So, that's your emphasis on your civil laws. No? So, we adhere to the limitations of civil laws to avoid evil and good. So, there are a lot of civil laws already. For example, there are laws that would mandate nga hindi allowed cigarette smoking in hospitals, or there should be a dedicated cigarette smoking area in the hospital. There are also laws that would say that there should be a breastfeeding room in each healthcare institution. Okay, so for example, if you are a nurse, okay, nurse ka abi, no? Bago ka lang nagbata, tapos nag-duty ka, may right ka for additional break to do your expressed breast milk. Okay? Are you familiar with EBM? Have you discussed expressed breast milk in maternal and child nursing? Were you able to touch that? Yes?
Wala
Okay.
pa, sir.
So, class, magambal kita nga. Ay, kay second year pa lang gali kita, no? Excited si sir. So, magambal kita, class, nga express breastfeeding. What you do is, okay, para mag-gets nyo lang kung diin pakadto ang mga civil laws. Okay? May mga laws na kita ya, class, patid, parte dira, no? That is embodied in your RA 10028. So, class, what do we mean by expressed breastfeeding? Magambal kita, class, nga expressed breast milk. Okay, as you can see, what's happening there, kung ikaw, for example, class nurse, bago ka lang kabata, di ba, kung bago ka bata, if you can recall your mothers, usually class, giginaya gatas mo. Bisan wala ang bata mo, sige, produce mo gatas. So what you do, you express your milk. When I say class, express your milk, what you do is that you collect it in a container and you place it in the refrigerator for future use of your baby. Okay? Kay class, kung hindi mo na pagpagwawan, what will you do? You will feel that your breast is engorged. You will feel that your breast is very full. Okay? So magambal class na engorged means that your breast is enlarged and your breast class is painful because of the milk that would not go out. So that's important. No? That's why we have laws like that. Okay? In a while, I need to do my charging. Okay, so as I've mentioned, this is part of civil law. This is under RA 10028, Republic Act 10028, the Expanded Breastfeeding Act of the Philippines. Okay, so, yep, that's it for that part. So there are a lot of laws. No? There are a lot of laws protecting different population groups. So there are laws, for example, on anti-violence against women and children. Memory serves me well, that is RA 9262. Okay, there are also laws that would protect the air. There is what you call your Clean Air Act. You have your Clean Water Act, among others. Okay, so those are all civil laws. And you must note that all civil laws are actually anchored on the natural law. So it is the reason why the preamble of the Constitution is stated in this manner. I don't know if you memorized this way back in your high school, but as you can see in the preamble, we are told that we should establish a government that shall embody our ideals, aspirations, promote the common good, conserve and develop patrimony, and secure to ourselves in the prosperity the blessings of independence and democracy, under the rule of law and the regime of truth, justice, freedom, love, equality, and do ordain and promulgate this Constitution. Okay? So if you would look at the preamble is the introductory statement of our Constitution. It was very clear on its purpose. Okay, it's to protect what is good. Okay, so remember that your laws, your norms, and your codes are references for human acts. And when I talk about your natural civil laws, cultural norms, okay, another thing is you have your cultural norms. When I say naman cultural norms, magambal kita nga normative. Kumbaga, ito yung nakasanayan. Ito yung naging practice in a certain culture, in a certain community. And when I talk about cultural norms, it is a product of time and space-related concerns. Okay? So pag sinabi ko class na time and space-related concerns, okay, it would mean nga, dugay na siya. Okay? It has been there for a long period of time already. That's why, as a nurse, we do not intervene and like say, sir, sara na yung inyong culture, change na. You could not immediately change the culture. Okay, you could not immediately change the culture. That's one thing that you need to consider. Okay, for example, in our practice here as nurses, okay, in the Iloilo, no, here in our setting, may makadto na bis hospital, mahambal na ang what you call this, ang family. Mahambal nurse may makadto nga bisita, ma'am baka dayon ma'am ano to tani nga naglisensya, hambal ya kay paluy ahan namon amon bata. Hindi gani ipasurhano namon amon bata. Are you familiar of that? Di ba? Familiar ka mo sa mga manugloy kag surhano. Okay? So, those are cultural norms. Those are cultural norms and practices. Even though we know that in the medical aspect, it has no bearing, but since it is part of our culture, we allow it. Okay? As long as they are not intervening on the care that we have. As long as, for example, wala lang saya ipainom nga kung ano-ano dira nga mga herbal supplement sa pasyente ta, allow them to do the surhan. Allow them to do the luya because that is what culture is mandating from them. Okay? So you cannot immediately change culture because it developed across time and some space-related concerns. Okay? Now, code of ethics naman on the other hand, if you encounter the term code of ethics, it's a formal statement of the group ideals and values. In our case, allow me to check if my memory is correct. Our code of ethics, if I'm not mistaken, is embodied in Board of Nursing Resolution 220, BON Resolution 220, series of 2004. Allow me to check if I'm correct. Yes, okay. So it's a Board of Nursing Resolution 220, series of 2004. Sir, ano na? Magambala ko Board of Nursing. Sila nang ga-govern sang nurses diri sa Philippines. They're under your PRC. Okay? So class, they issued the resolution in 2004 and dira na ang code of ethics ang nurses. Okay? Dira na din nakabutang kung anong dapat ang ubrahon naton, how can we care for the society, how can we care for the individuals, how can we care for our fellow nurses. Okay? It is shared by the members of the group. It reflects our moral judgment over time and serves as a standard for their professional actions. That's why class, no? Kung ikaw nga nurse, ng third party ikaw, for example, balaan mo nga married na to. Married na si A kag si B. Tapos ikaw si letter C, nagsulod ka pa sa relasyon nila, nga balaan mo na gid nga married sila. Tapos nurse ikaw. Okay, that's against your code of ethics. Because your code of ethics tells you that you should protect the family. Okay, you should protect the sanctity of the family. Why is it that you know that A and B is already married? You entered the relationship and became a third party. Okay, so as a nurse, parang they say that mas dako ang penalty mo because by your code of ethics, you are supposed to support family and strengthen them, not to break them. Okay? So those are some of the functions of your code of ethics. Now, it's also our contract with the society on how professionals will behave in accordance with the rule dictated by the society. Okay? So those are some of the documents of importance when we are talking about our ethical